Buenos dias, this is Scott Oliver with CostaRicaHospital.com. Here today in Hospital Metropolitano in San Jose, Costa Rica with Dr. Rodrigo Sequeira. Dr. Rodrigo is an orthopedic surgeon. And Dr. Rodrigo, if you would please, give us an idea of the sort of qualifications you have to practice as an orthopedic surgeon here in Costa Rica and how that compares with a surgeon, for example, in the US.
Thank you, Scott. It's a pleasure to be here with you. And I want to start saying that I'm an orthopedic surgeon here in Costa Rica. I'm from the University of Costa Rica, that is the biggest and the main university here in this country. And I studied there for 5 years to obtain my degree in orthopedics. I'm also an international member of the American Academy of Orthopedic Surgeons. And I have a lot of experience doing arthroscopy surgeries and total knee replacement and total hip replacements.
So with the experience that you have, I know you've worked with dozens of patients from North America. Give us a clear idea, if you would, about any differences between the surgical techniques and the equipment that you would use here for knee replacements or hip replacements, again in comparison with what they have in North America.
Well, it's pretty much the same as in the States or in a developed country. We use the same techniques, we have the same equipment, and we use the biggest brands in orthopedic surgeries. For example, here in Costa Rica we use Biomed, we use Smith & Nephew replacement, we use Zimmer hip and knee replacement. So here in Costa Rica it's pretty much the same surgery that you will have in the States. If you come here to have a total knee replacement, a total hip replacement, or even if you come here to have an arthroscopy, it's pretty much the same technique and equipment that is used in America.
Now, you mentioned to me earlier that you're doing sort of 15, 20 arthroscopies per week, right?
Yeah, sure. It's like the most common surgery here that we do. And usually it's like 3 to 4 patients every day. Mm-hmm. So we have like a big experience doing those kind of surgeries. After
something like a knee or a hip replacement, I'm assuming people have to stay here and recover before they can go home, but some people don't have a lot of time. So what would you recommend time-wise? How long do they have to stay here before they're actually able to go back home without risking anything?
Okay, I would recommend to stay here in Costa Rica for at least 15 days. It's better to stay here so we can check out the wound. We can see if the patient has any concerns about pain or the wound or the swelling after the surgery. So I would recommend for the patient to stay here for at least 2 weeks to start rehab and to check the wound.
Okay, and as far as physio is concerned after this?
The physio, we start with the physio the first day after the surgery. We start moving the leg, the knee, the hip. So we start the physio really quick to recuperate the patient sooner.
A major concern for any procedure in any hospital is infection rates. But one thing that did surprise me with my conversations with Dr. Rodrigo is the fact that even after 4 years and after many, many hip and knee replacements, he hasn't had a single case of serious infections. So tell me, Dr. Rodrigo, how you've managed to keep such a non-existent infection rate with all the procedures you've been involved with so far?
Okay, I think that the main reason of that is that we are very proactive on avoiding infections. We make a complete check of the patient. We take blood tests, we take a blood sugar test, we check the patient skin, we check their mouth, we check their toes, their feet, to check out if they have like any source of infection in their body. So I think that the main reason it would be that we really check the patient before the surgery. So we try to avoid the infections rather than treating the infection after the surgery.
So being proactive rather than waiting till something happens and then...
Exactly.
So when it comes to safe and affordable surgery solutions for hip replacements or knee replacements or arthroscopies, Dr. Rodrigo is probably a good man for you to speak to. And if I remember rightly, you said you also do arthroscopies on the ankle, which is not that common. Is that correct?
Yeah, sure. I have experience also in ankle arthroscopy that, as you say, is not as common as knee or shoulder arthroscopy, but it also is a very useful technique to address ankle problems. And I also do a lot of surgeries on bunions and hammer toes.
Excellent. Once again, this is Scott Oliver with CostaRicaHospital.com saying thank you to Dr. Rodrigo Sequeira.
Okay, it's a pleasure to be here with you.